Health officials across the country now scrambling to get the message out on a scaled back New Year's Eve. This as the fast spreading Omicron variant brings record high new cases across the nation. I want to welcome our next guest, Dr. Shad Marvasti. He is an associate professor at the University of Arizona. Doctor, welcome to BNC Live. It's a pleasure to have you. So we're bringing in the new year in a matter, of hours. Should we just be canceling New Year's plans and just celebrating on the couch?
I think that would be the best course of action. I think if you're going to get together, you need to take certain precautions. I think you need to wear N95 masks when you're outdoors, indoors, in public. I think when you're getting together with loved ones, if everyone's fully vaccinated, you may want to also do a test before going to visit with those loved ones, especially if they're elderly or have a chronic condition, which puts them at higher risk. So you don't give that to them when you get together. But I think keeping it more low key this year, unfortunately, would be a better bet given the record surge that we're having. We've broken the world record in terms of new cases just in the last 48 hours, and it's only going to get worse from here. So I can't see it being reasonable or thoughtful at any point in the pandemic, if not right now, to hold off on those types of large indoor gatherings such as New Year's.
Yeah. Are you shocked by the numbers?
I am not shocked by the numbers.
Why?
And the reason why I'm not shocked by the numbers is we know how transmissible Omicron is. We already saw a month ago that it was doubling every 2 to 3 days in the UK and in South Africa. So we knew this was coming. We just, really don't have anything in place in terms of public health to stop it from getting to where it is right now. So we have no national mask mandate. We have no national vaccine passport or vaccine requirements. And we are already in the midst of winter illnesses and emergencies. So when you add Omicron and a continued Delta wave that's still there, you basically get overwhelmed hospital systems and you get nothing to stop people from getting sick in the first place. And then you get crisis standards of care where people who have a heart attack can't get in to, get their arteries opened up. You get people who have cancer who can't get necessary treatments, surgeries that can't happen, and all sorts of downstream effects. This was predictable and preventable. Because of misinformation politics, we don't have all the public health mitigation measures to protect us in place.
Yeah. Walk us through what you're seeing in hospitals.
What we're seeing in hospitals, as a clip before showed, it's just ridiculously crazy. It's beyond what it's been at any other point in the pandemic, because not only do you have Omicron, you have Delta, you have flu, which we're seeing much more flu this year, especially since the flu vaccine didn't happen to match up with the most common variant that is spreading right now in terms of the flu. And then you've got all the other emergencies, right? So basically, we're seeing rationing of care. We're seeing people being sent home that otherwise would have to stay in the hospital, sent home with oxygen. People who need to get urgent care, who they're just waiting for half a day or longer. So this is really substandard care, and I really would not wish anyone that I know and love in my family or among my patients to get sick at this time of year, because this is really the worst time to get sick and require emergency care.
Yeah. So what are you telling your staff members? How are you keeping morale high? I mean, we're going into
Well,
another year of this pandemic.
it's really hard. It's really hard. It's tough to do that because we see, and here in Arizona, it's even worse because we happen to be one of those states where, our public health has been undermined by state officials because of politics and misinformation, where we've been banned from having a statewide mask mandate, where we've been banned from having vaccine requirements and things like this in schools and in organizations. And so when we see people just kind of out in public doing everything they normally would do as if there's no pandemic going on, and then you're dealing with what you're seeing in the clinics and in the hospitals, we're disillusioned and beyond upset. And just, we've written an open letter to our public and official health officials and state officials here in Arizona. Similar things have happened with colleagues around the country and other states. I think we're exasperated. It's just, there's really nothing you can do but just try to survive. And with people actually getting sick now in the healthcare worker teams as well, that adds to the problem, right? Because we're not able to take care of you because we're sick ourselves.
Yeah, you sound exhausted. Can hear it in your voice.
I am. It's frustrating. I mean, I don't even know at this point. It's just madness. It's just complete and utter madness. And you see places, there's some states, like Hawaii, I think, California. I mean, they have requirements of people coming in with vaccines or negative tests. We need to put those requirements in. At this point, we've found the latest data from the CDC. If you're unvaccinated, you are 20 times more likely to die from COVID than if you get the COVID vaccine. So at this point, I think we need to require vaccines for restaurants, for bars, for traveling on airlines. I think we just need to do that at this point. I mean, if you don't want to get it, then just stay home or stay low key. But at this point, we can't afford to keep spreading it because our hospitals and our healthcare workers can't take care of you for anything else. We need that, and we need a national mask mandate, and we need updated available tests. I think those three things need to happen right away. And unfortunately, because of politics and misinformation, we're not going to get them. And that's why things are only going to get worse.
Strong warning there. Dr. Marvasti, thank you so much for joining us, sir. I pray that things get better for you and your fellow healthcare workers, because I can just hear and feel your exhaustion. And we see it with the case numbers and the fact that this virus has continued to just wreak havoc on all of us. I just thank you. Thank you for staying in the
Thank
game.
you.
Happy New Year, too. All right, now switching gears. Are you ready for one of the most challenging New Year's Eves ever? I think I said that right. An explosion in COVID cases crashed plans for what was supposed to be a holiday comeback. What is that? Well, coming up in our next segment, we're welcoming the new year without welcoming an unwanted viral visitor into our bubble. We'll tell you about that next.
You're watching BNC. I'm Yori Tawilder from Making the Case. Happy holidays from Black News Channel.
Happy holidays from everyone at BNC.
Here's important information for anyone with an annuity or structured settlement.